You know that sudden shortness of breath you get sometimes? Or that weird little flutter in your chest? Or maybe a dull ache you just can't quite place? Well, these aren't just random things to get anxious about. Think of them as clues. They're actually messages from your body's most important organ. So today we're going to put on our detective hats and learn how to decode these signals to figure out what our heart is really trying to tell us.
So, what is your heart trying to tell you? I mean, that's the central question of our whole investigation, right? We're about to dive into the most common symptoms and complaints related to heart health. Now, we're not here to play doctor, of course. The goal is to understand the language our body uses when it's trying to communicate with us. Every good detective story starts by profiling the suspects. And in our case, the suspects are the 6 main clues, those primary symptoms that might point to something going on with your heart. So let's line them up and see who the key players are in this mystery.
Okay, here are the main pieces of the puzzle we're working with. We've got shortness of breath, pain around the heart area, palpitations, that feeling of a weird heartbeat, a nagging cough, and something called edema, which is really just the clinical term for swelling. We're going to investigate each one and see how they all fit together.
But, to crack any case, you've got to focus on the most important leads first. So we're going to start with the 2 clues that cause the most worry and are absolutely critical to understand: pain and that feeling of pressure, which often shows up as shortness of breath.
All right, it's time. The interrogation begins. We're putting these 2 major symptoms, pain and shortness of breath, right under the microscope to see what secrets they're hiding.
And right away, we hit our first big surprise. Get this. Not all chest pain is actually coming from your heart. It could be something like pleurisy, that's when the lining around your lungs gets inflamed, or even intercostal neuralgia, which is just a fancy way of saying a sharp nerve pain between your ribs. So you see, where the pain is, that's just clue number 1. It's not the whole story.
So how in the world do doctors tell the difference? Well, they have a system, kind of like a detective's checklist. They ask specific questions. First, where is the pain exactly? Does it spread out or irradiate, as they say, to your arm or your neck? When does it pop up? What does it feel like? Is it sharp, squeezing, burning? How long does it stick around? And this is a big one. What makes it feel better or worse?
And this right here shows you exactly why that checklist is so vital. Just look at this comparison. For angina, you're often looking at a pressing pain that lasts a few minutes and gets better with rest. A heart attack, on the other hand, is way more intense, lasts longer, and rest doesn't help. And then you've got something totally different, like cardioneurosis, where chest pain is tied more to anxiety, feels different, and actually responds to sedatives. See? The details are everything.
Now for our second key clue, shortness of breath. The official name is dyspnea. That feeling of not being able to get enough air in, well, it's often a sign that the left side of the heart, the left ventricle, is having a tough time pumping. This can cause fluid to back up into the lungs, creating what's called congestion.
Okay, let's shift our investigation. We've looked at pain and pressure. Now we're going to focus on the timing and the rhythm of the heartbeat itself. This is where things can start to feel a little, offbeat.
Probably the most common clue in this category is what we call palpitations. It's a pretty broad term, but it perfectly describes that feeling when you're suddenly super aware of your own heartbeat. Maybe it feels too fast or too strong, or it's just got a weird, irregular rhythm.
And these descriptions just nail it, don't they? That feeling of your heart sinking or fluttering, or that terrifying feeling like it's just stopped for a second. These are such powerful descriptions that really get to the core of what these irregular beats can feel like.
So what sets these feelings off? Well, the list of potential culprits is pretty long. It could be your body's fight or flight response kicking in because of stress, or maybe some intense exercise. But it can also be linked to other things, like a fever or even an overactive thyroid. The main point is, a lot of different things can throw your heart's rhythm off.
All right, next up, we need to investigate the ripple effect. Because here's the thing, the heart doesn't exist in a vacuum. When it's having trouble, it can send out signals to totally different parts of your body. This is where you really start to see how interconnected everything is.
A classic example of this is edema, that swelling we mentioned earlier, usually in the legs and ankles. This is rarely just a random thing. It can be a very specific clue that points to trouble with the right side of the heart, which is struggling to pump the blood that's returning from the rest of the body. And here is a super fascinating detail and a huge diagnostic clue. Edema that's related to the heart has a very distinct pattern. It's usually much better in the morning after you've been lying flat all night, but then it gets worse and worse as the day goes on and gravity does its thing.
And those ripples just keep spreading. Remember that fluid backup in the lungs we talked about with shortness of breath? Well, that can also be the culprit behind another major clue, a persistent dry cough. And in more serious cases, that same fluid backup can even affect your abdomen and lead to digestive problems like nausea. It really is all connected.
So, we've profiled our suspects, we've followed the clues, we've seen the ripple effects. But now we come to the single most important part of any investigation, the witness. And in this case, the star witness is you.
And honestly, this is the whole point. A doctor has the training and all the tools, but you have the most critical information. You're the only one who knows exactly what you're feeling, when it's happening, and what it feels like. You are the primary source of evidence.
So, the bottom line is this. Learning to be a good witness for your own body is a skill. When you can use that detective's checklist we talked about, describing the timing, the nature, the triggers for your symptoms, you are handing your doctor the exact clues they need to solve the case, and to do it quickly and accurately.
So, the clues aren't a mystery anymore. We've cracked the code on the signals your heart might be sending you. The only real question left is, now that you know what to look for, are you ready to stop, pay attention, and truly listen to what your body is trying to tell you?